Well, the prostate is everything. As we age, the prostate changes. It can become cancerous, it can become enlarged, and it can also become inflamed. It's something that affects all men as we age.
This is the Man Up Podcast, a doctor's guide to men's health.
If you've been enjoying listening to our podcast, please hit the subscribe button on YouTube, Spotify, and Apple Podcasts.
My name is Dr. Kevin Chu, and I'm joined as always with my co-host, Dr. Justin Dubin. All right, guys, Dr. Mehan has joined us today to talk about something I think very interesting that a lot of our patients always ask us about, and that's supplements and its use in, enlarged prostate. So I think this is going to be a really good conversation. So first off, Dr. Mehan, thank you so much for joining us here. We're here in your home state right now.
Yeah, my pleasure. Happy to be here.
Yeah, man. And we had such a great time with you on the podcast last time. Thanks again for coming on. You really are one of the masters of the prostate, BPH, and we're really honored to have you and to giving us your knowledge on this topic.
Glad to be here. Yeah.
All right, so let's dive right on in. So what role does the prostate play in men's overall health, and why is it important to take care of it?
Well, the prostate is everything. As we age, the prostate changes. And, I look at men in their 50s and their 60s, and they go through this prostate puberty where it just starts growing. And it gets enlarged, and it causes problems with urination. This is what keeps guys up at night. It's what, drives them to find bathrooms when they're out and about. And it definitely affects their quality of life as they age. And it has other issues too as we age. Prostate cancer, which is a separate etiology, a separate entity, and that comes in play as we age as well. So, it can become cancerous, it can become enlarged, and it can also become inflamed. I get a lot of younger guys, even in their 40s and 50s, that come in that have urinary symptoms, but it's due to inflammation or prostatitis. So it's something that affects all men as we age.
You mentioned this interesting idea of prostate puberty. I've never heard that term, and I really like that. And that kind of is a great segue to the next question is, at what age do men on average start having prostate problems and maybe hit this prostate puberty?
Typically in our 50s. When we turn 50, mid 50s, 60s, that's kind of the prime where the prostate likes to grow.
All right. So for our listeners, what are some common signs and symptoms that suggest you have an enlarged prostate?
Well, these are changes. These are the changes that, if you're the last guy at the urinal, if you know where all the bathrooms are at Home Depot and Lowe's, out here in Arizona, a lot of guys drive out to Vegas and they know where all the stops are. I mean, those are the signs. This urinary frequency, urgency, waking up at night, dribbling after you urinate, stopping and starting. All those things are classic symptoms of an enlarged prostate.
Yeah. Now we're going to start talking about supplements, though. Now, my question for you is, why do you think men are interested in taking supplements for their prostate health?
Well, did you know half of men in the United States are on a supplement?
I did not know that. Did you know that?
No.
And 70% of men after the age of 70 take a supplement. It's crazy.
That's crazy.
It is. It's a multi-billion-dollar industry.
Right.
And because you can, a lot of men are nervous about seeing a doctor, and they will self-medicate with supplements. Something you can go to GNC, you can go on Amazon, and if you have a problem, you can get a supplement to fix that problem. It's readily available and it's easy.
I just sent a tweet to Justin this morning about how on Amazon, one of the most profitable single products is Nutrafol, is a supplement. It's like 8.5 billion. It's some crazy number. And it's just that sole product, which is
for hair
insane.
growth, I believe, right?
Yeah.
Female hair growth.
Yeah.
So, I mean, it's just always interesting to me. And we were talking off recording because, I always find it interesting as something, I guess the supplement is natural, right? That's the idea, that the supplement is something that's natural that can potentially help. And I guess when it comes to some kind of medical intervention versus some natural intervention, people like the idea of something natural. But, it's something that I still struggle with because I mean, I mentioned before, I have taken L-citrulline, I've taken some stuff in the past, and you do have some benefits. I've felt the benefits of it, But I always find it so interesting. And that data you said was fascinating is how many people really love being on supplements. It's so interesting.
Well, let's get into that
Yeah.
important question here. All right, let's ask Dr. Mehan. We see a lot of commercials and ads on TV and online promoting, prostate health supplements. Can these supplements really prevent or treat benign prostatic hyperplasia or enlarged prostate, or is this all a huge marketing gimmick?
No, I really do think there are many benefits from supplements from a men's health standpoint and a prostate health standpoint. And there's so many that are out there. And this has been out for a long time. We call this phytotherapy, where you have medications derived from plants. And this goes back to the Egyptian time, like 13 BC. We have records of this ongoing over time. And there's just so many different things that have been put out over the years that people use. Probably the most well-studied one is saw palmetto. And as urologists, it's something that was part of our guidelines and that which has been thoroughly studied. There's 2 large clinical trials put on by the NIH where they looked at saw palmetto and they compared it to a placebo, and they found no improvement compared to the placebo. And they took that out of our guidelines that we don't really recommend men to start saw palmetto. But there are other smaller studies and other studies that have come out that show benefit. And there are millions of men that take saw palmetto for their prostate. It's fascinating. It's not something that I prescribe to men as a urologist, but I'm aware that most of my patients have tried that or are taking that. It's fascinating. There's so many other medications and supplements that are out there. And I think when I look at prostate supplements, I break it down to a couple different areas. And I think this is a great podcast to kind of categorize things. And there are certain supplements that I do recommend as a urologist. And, I was talking to a couple other urologists and I said that to them. They're like, no, the supplements don't work. Like, we're like scientists. Like, there's no evidence-based medicines behind it. But there are. A lot of these have been studied, and it's fascinating. So outside of BPH, when you start talking about prostate health, I treat a lot of men with both BPH and prostate cancer.
Right.
Great article came out in Journal of Urology in 2022. This is just recent.
Yeah.
And they looked at zinc use in men who've had prostate cancer. And this was a prospective study that looked at 5,000 men, over 5,000 men, and they followed them for 11 years. And those that were on low dose daily zinc had lower mortality rates overall and lower death rates from prostate cancer. And I read that back in 2022. I was like, this is fascinating, because zinc is something that, we don't really talk about or think, but prostate is full of zinc. In our bodies, the organ that it has the most concentration full of zinc. Really? Yeah. And how the prostate works, there's zinc there. So it's been studied for a long time. Swedish did a study on it where they gave men really high doses, 100 times a dose of zinc that you should. And it actually, they found a higher incidence of new metastatic prostate cancer in those men. So you don't want to take like mega doses, but if you take a normal amount in this study, which is a great study, Journal of Urology, they showed that it actually decreases mortality from prostate cancer and overall mortality. So I have my patients that are diagnosed with prostate cancer that are non-metastatic start on a multivitamin that has zinc in it, or just a low dose of zinc. I think it makes sense. There's evidence-based medicine there. The other thing that I recommend as a urologist for patients, a lot of guys that come into prostatitis, you have to categorize it. And there's some men that have non-bacterial chronic prostatitis. It's not due to an infection, but it's just chronically pissed off. And it comes in waves, and you get a lot of younger guys that come in and they want to be treated for an enlarged prostate because they're having urinary symptoms, but it's not. It's an inflamed prostate. And to distinguish that there's some nuances there. We do a lot of testing and we look at it. But I ultimately diagnose a lot of men with this non-bacterial chronic prostatitis. And there's alternative medications that you can do it. And phytotherapy, these supplements really work well. I often prescribe one of these supplements to men with those conditions.
So, it's so fascinating.
Yeah.
So can you give us a breakdown then, or just give us a list of the supplements that you often recommend? You mentioned zinc, and a multivitamin potentially. What supplements in general do you recommend for men, for prostate health?
Well, it depends what we're looking at. So
Right.
those that have been diagnosed with prostate cancer, I think a normal amount of zinc supplementation is important. In the United States, the recommended daily allowance is 11 milligrams per day. So That's a good amount of pitcher multivitamin, and you want to see that amount in it. So I think that's for zinc. I like that. If you have inflammation and that's driving your urinary symptoms, I recommend quercetin and ryegrass. Both have been studied. There's several really good studies that show that that may help men with inflammation, taking out inflammation in their bodies and in their prostate. I like saw palmetto. I think that's a good anti-inflammatory property as well. You know, a lot of these supplements tie into diet. So having a lot of fruits and vegetables, but in saturated fats all play a role in this as well. But supplements, I think, you know, play along with that. So, you know, it's not necessarily taking a supplement. I really push lifestyle changes as well with this.
And that's very important, right? Lifestyle changes builds the foundation. Everything else is just kind of like an augment on top.
Yeah, I mean, I just want, so just to confirm, so you recommend, it's very interesting. Saw palmetto, you agree, doesn't help for urinary issues, but when we're talking about because of big prostate, but when you're saying for inflammatory, like those patients who you say maybe have a chronic prostatitis, you do feel that there is some help. Absolutely. That's cool. So I think that understanding the role and setting the expectations for how they should be used and when they should be used. There's so two different situations for your prostate health, but they're actually, you know, and one supplement, one works, one doesn't.
Yeah, the other ones that are out there that have been studied that I think are worthwhile talking about. One would be beta-cytosterol, which is a plant sterol that are found in fruits, vegetables, nuts, and seeds. And we've taken them and prescribed them in the past to lower cholesterol, to take down inflammation. There's some interesting studies. There's a study out of Europe where they actually put men on that, and for 12 weeks they found and improved their flow rates and increased their symptom score. You know, it's hard to say. We don't really understand the mechanism of action of these drugs. They may play a role in similar to how like Flomax works or how finasteride works with relaxing the prostate and shrinking the prostate. There's, you know, that's one that's really well studied. You'll see in a lot of supplements. There's this African tree, take the bark of it, and that's called pygeum. And that's another one that's been really well studied. There's several small studies, but they show pretty drastic improvement in urinary symptoms.
I think that's a good point. I think that might be why a lot of physicians are kind of nervous about supplements, because we're seeing, like, just studies are done and you're seeing results. But if we don't really fully understand the mechanism of action, as a scientist for us, you know, we're kind of like, well, how's this working? That can scare people.
I think that's fair.
Yeah. And, you know, it's hard because none of these supplements are regulated by the FDA, and looking at the dosages and looking at, you know, the company that makes it, it's hard. You know, if you find one that works, I have a lot of patients that try a lot of different ones and they find something that works, and, you know, I would stay with, you know, with a lot of it's trial and error. So it's kind of really hard to know what you're getting or how much you're getting. So it's a little dicey.
Now, are there any prostate supplements that you would tell patients, like, just absolutely don't take that?
No, because I don't, you know, we don't really know. There's a ton of them. There's a ton that are out there that put out. Some of them do have side effects. So, for example, let's go over, like zinc. If you take a mega dose of zinc, it can actually increase the risk of advanced prostate cancer among men. That's been shown in the study. Several, like quercetin, if you take quercetin for too long, it can impact the kidneys. You really should take that only for 2 to 3 months at a time.
Palmetto, I've seen one patient actually with post-finasteride syndrome from saw palmetto because of this, a 5-alpha reductase inhibitor.
Yeah.
So I saw it once on a young guy who said, so it is something that as,
yeah, it's a controversial.
Yes, it is. But I'm just saying, I'm just telling you what I saw. So it is something to consider too.
There's, and it's interesting too, another one for the beta-cytosterols, they've been linked to, there's some substances that are linked to low sex drive and erectile dysfunction. So, you know, a lot of people are worried about medications and side effects there, but these have side effects as well. Even though they're natural, it can still cause similar side effects that we see with the prostate medications that we prescribe.
Yeah, I mean, it's so interesting, and you just highlighted that there are always risks with these things, and especially because they're not regulated. What's in there may not necessarily be what's on the label. Supplements more effective when we're considering them for preventative purposes, or, you know, are there certain values of actually when you're having a prostate issue, right? Like, are we trying to use supplements for preventative measures to prevent myself from having issues, or, you know, is it too late when I already have these kinds of symptoms?
This is great. And, you know, we don't really know. to be honest with you, there's not a lot of good long-term data to drive this, but it scares people. More men with family histories of prostate cancer are likely to take a prostate supplement. I have there's several studies looking at that, but people want to know. They want a natural approach to it. They want to be protected. And, for me, it's really prescribing lifestyle changes that make the biggest impact. But cancer is cancer, and prostate puberty is inevitable. If that's going to happen, your prostate's going to grow. We don't know yet how to stop that process, and we don't have good data that any of these supplements will do that.
I think it's so interesting because of, we're trying to become more preventative in medicine. And like you just said, you don't know how to stop the prostate from growing. And we don't know whose prostate is going to grow, or we don't know how to predict that as well, right? And I think it all comes down to what you've said, diet, exercise, lifestyle factors. It still sounds like are the best ways to at least alleviate whatever symptoms may be coming your way.
And here's the other thing. If you're suffering, if you have severe symptoms, we have better options.
Yes.
Yeah.
Only 2% of men that have severe symptoms get treated for their enlarged prostate. 98% of them are living with it. They're probably on salt palmetto.
Yeah.
And they just don't know that there are better options out there. Typically, when we rate symptoms and we look at improvement, we have this score system that we fill out. It's this 80-way symptomatic score. You can go at home and Google it and put your score there, and you can rate your symptoms from 1 to 35, and you can rate your quality of life from a urinary standpoint. And if you see a significant improvement, it's usually a 3-point improvement in your AUA score, or moving your quality of life up 1 point. So fill that out, try a supplement, and look at it. There's also home tests. I use this thing called a NanoFlow. It's an app. People pee and look at their flow. Go on one of these medications for 12 weeks, check your flow rate again, see if it makes an improvement. And if you're suffering, if you're waking up at night, and if all those symptoms, if you're not getting better, see your urologist. We can help. We have so many options. It's been a renaissance of technology that's available and far less side effects than they've had before. You don't have to be scared of treating for BPH. We can help.
I love that. And Justin, I'm sure you see it as well too. Guys coming in who are like, hey, look, I've been on salt meadow for like 3 years. I'm struggling here, but I'm not taking any of that pharma stuff. Even though you're like, hey, this is shown. This is going to potentially help you, or even surgical interventions. There are things that can help you get better, like achieve better quality of life. That, sorry, it doesn't seem like that salt meadow is really kind of important.
Yeah, and I think that it sounds like, and I agree. I think the most important thing here is that this may not work for you, and that's fine. But if you don't say anything to anyone, you're never going to get help, right? Like, we are doing such a bad job as men talking about our peeing problems as much as our penis problems. And we all just want to take something over the counter, live our lives, be a little bit more miserable. But we had this conversation last time you were on when we were talking about BPH surgical options. It's like, if I'm a patient, why do I want to forget even if it's a supplement that's maybe doing a little bit, or another medication that's maybe making me pee a little bit better, I'm still kind of miserable, or do I want to do a 1-day procedure? I'm out as an outpatient procedure, and I'm pissing like I'm 18 years old again for the rest of my life. I think that we have to shift the perspective of saying it's okay to just struggle a little bit every day instead of, doing a small, low risk procedure that can really improve your quality of life for the next 30 years.
Yeah, 100% agree.
So Dr. Mehan, let's, as we kind of end near the end of our conversation, how do you counsel, like, I just want to hear what your counseling is for patients on prostate supplements. Let's say you come in, patient comes in, and there's like, all right, doc, so like, could you give me your recommendations? Like, should I take prostate supplements?
Oh, I love that. I love supplements. I think there's a lot of benefits outside of the prostate too. Salt palmetto can help your hair look more thin. Again, there's a lot of benefits from all these things that get that. And I have no problem with it. But, I'm a realist. There are studies out there. We looked at these 2 large studies of salt palmetto, how they impact men and their urination. And they've really shown that there's not a huge improvement with these medications. They modestly low. There will be something. So I don't think a person should try it. I don't prescribe it, especially for just BPH symptoms. I don't think it hurts. I don't take that away from you. If you have something and you think it's helping you, go with it.
Yeah, I mean, I think so. I guess the final comment here is, any final comments, concerns, or for our listeners about prostate supplements and their status for use?
Well, the issue too is a lot of men don't know what the reason why they're having urinary problems. Could it be prostatitis? Or is it an enlarged prostate? They don't really know. So taking a supplement, if it takes some inflammation and you feel better, that may help you. There are risks with taking supplements. There's a cost of taking supplements. But I think, it's like the gateway drug. If you start taking a supplement, if you're on a supplement, probably got a problem.
Right.
If you have a problem, get help. And you really need to see an expert to manage that. And I think that should be your call to see a neurologist.
I think that's a great way to end it.
Right.
And I learned a lot about a lot of new supplements that I actually didn't know about. That's pretty cool.
I don't put chronic prostatitis.
Yeah, it's actually a good look. I think that's a great option. So where can our listeners find you? And tell us about your socials. Tell us about he is amazing. If you're not following him on TikTok,
Yeah.
my God,
Yeah.
amazing.
I'm Dr. Mehan, DOCTOR, Mehan on Instagram, and Saved by the Balls on TikTok. What an amazing practice. I'm a really good urologist here in the Phoenix area. And I just love what I do. I love helping men. And, if you have any questions, hit me up on social media. I'll answer them.
Yeah, he's a great follow. He provides some really wonderful information, and he's truly a master surgeon that we really all look up to, and just love having him on and learning from him. So thanks again for coming on, and thanks to our listeners as always. Until next time, have a good one.